Hi, my name is Emily Adams-Schmeck, and today we are going to be talking about dynamic assessment for Native American children. So first we're going to talk about the importance of proper evaluation for Native American children. This is important as we want to avoid Native American children being over-identified or under-identified for speech and language services. It also provides the best culturally and linguistically appropriate services for Native American tribes and for understanding the difference between a language disorder versus a language variation based on culture. It is important to provide proper evaluation for Native American children as there is a difference between Native American English versus Standard American English. So first, the culture, linguistic, and social linguistic characteristics differ from Standard American English, those who speak Native American English. So for example, dialectal variations occur when speaking English is influenced by native languages. In the past, there have been some issues with other forms of language assessment in relation to testing Native American children. So some examples include there have been frequent and appropriate placements in special education programs. Some examples can include translated assessment instruments that have been translated improperly. So the results coming from those are inaccurate and do not represent the child in and of itself, as they were not presented correctly in the translated form. Next is treatment approaches violating client and family values. So an example can be using untrained interpreters with information being translated inaccurately. And this rightly can cause offense to the families as what they are saying and what they are receiving is not being translated properly. Next is speech and language difficulties that are misidentified or under-identified. So a lack of culturally and linguistically appropriate screening and evaluation materials for Native American tribes has been apparent within the process of language assessment for these children. So we need better assessment tools to use so that we can incorporate their cultural and linguistically diverse backgrounds. So next we're going to go into what exactly is a dynamic assessment and how is it helpful. So a dynamic assessment evaluates a child's response to learning situations, and it assesses the client's approach to tasks, patterns of errors, and self-correcting errors. So what exactly is assessed during a dynamic assessment? So this form examines the children's response to learning situations rather than traditional assessment measures, which these ones examine only product-oriented static measures of performance, as dynamic assessments measure a more holistic approach in how the child is performing in these very natural settings. Next, it involves mediation, so structuring the social environment to reveal and improve their learning behaviors. And then lastly, the assessment includes information of attention, planning, self-regulation, application, motivation, response to intervention, and then the examiner's intensity that induces change within the client, and then how much the client is able to carry over what they have learned. Next, we're going to be talking about a research study that was conducted on 23 Native American kindergartners using the dynamic assessment. So during this study, the dynamic assessment was applied to Arapaho and Shoshone children. The dynamic assessment was evaluated in comparison to the reference points of Native American teacher judgments of learning ability and the examiner classroom observations. So in a test, teach, retest format, the reliability identified Arapaho and Shoshone kindergartners previously classified as weaker or stronger language learners. So the learner level was differentiated through ratings of modifiability, a combined measure of reflecting learner characteristics displayed during the teaching phase. During the study, mediation responses such as responsivity and transfer showed greater differentiation than learning strategies, such as motivation and attention. So the raw scores on a standardized test of expression categorization showed significantly greater post-test performance for children identified as stronger language learners than those identified as weaker language learners. So stronger language learners moved into the expected range on post-testing, whereas weaker language learners made little gain with this brief mediation period. Both ratings of modifiability and change in test scores provided important information toward a diagnosis of a language impairment in a minority child. The dynamic assessment showed strong potential as a language evaluation approach for distinguishing the differences from a disorder in minority children. So, how is dynamic assessment an appropriate form of testing for Native American children? Many Native American children still speak their native languages at home, and this form of assessment provides a holistic response to communication patterns in home and community of Native American tribes. The framework of this assessment is to distinguish a language disorder from a cultural and linguistically diverse background so that we are not misidentifying children as having a language disorder. And then next, we're going to talk about the clinical relevance to dynamic assessment for Native American children. This has clinical relevance as this form of assessment provides culturally responsive results on if a child needs speech therapy services. So the results can indicate what type of goals need to be made for the specific child in speech therapy. Examples can include if they need help with multiple step directions, if they're having issues with receptive language skills and expressive language skills. And this next slide includes all the references that were cited within this presentation. And thank you for listening.